after the ECHO session via email. You all did this, quite a few responded to the first one, so that was great. Please complete the survey via SurveyMonkey within 1 week, and then a CMS certificate will be emailed within 1 month of the completion of the survey. So we're going to roll right into the didactic. Anna, here you go. So we are so excited to have Anna presenting for us today. She is the Senior Intervention Manager for HPV vaccination for the American Cancer Society, and as she said, is joining us from New Orleans. So the beauty of technology, for sure, where it's like we're all in the same room together. So I just want to give a quick bio for her to understand her background. After attaining a Master's of Public Health in Epidemiology, Anna has managed several corporate and federally funded research projects in reproductive health, cancer, and HPV vaccination. Among her various scientific interests has been the engagement of health systems to increase HPV vaccination rates through clinical level interventions and quality improvement efforts in order to improve system-wide processes and educate providers that the HPV vaccination is cancer prevention. So her title today is Quality Improvement in Evidence-Based Interventions, and it folds nicely into our case presentation as well. So Anna, I'm going to turn this over to you.
Wonderful, thank you. Hi everybody, it's great to be here with you again. So the title again is just Quality Improvement in Evidence-Based Interventions. These are not small topics, and I have 10 minutes. I'm going to give a high level and then some links to dive in deeper. Next slide, please. So the main objectives is to review the quality improvement framework and then highlight a few evidence-based interventions that we know are associated with increasing HPV vaccination. Next slide, please. So we have over 400 staff in the nation that work with health systems, much like you, on different cancer prevention components. For this one, this is our roadmap, our toolkit for HPV vaccination specifically. This is our steps guide for increasing HPV vaccination in practice. There's a link you can click once you get the presentation, but it also lives on the HPV vaccination roundtable resource guide. It was originally created in 2015 and has been used and evaluated based on many FQHCs and integrated delivery systems throughout the nation since then. So every time we know better, we do better, and we tweak it as we go. But it really focuses on 4 main steps. Next slide, please. You'll see different hues of blue, and we'll go from the top left down to the bottom right. So these are very broad categories, but when we're connecting with the system and trying to plan out what could our clinical intervention look like, we try to say these 4 components are a place to start and grow our work. So assembling a team. So you've already done that. The people that are standing next to you, the people that are in your system. Your team can look different ways. It can be your internal core team, the folks that do a lot of the quality improvement work or make your goals or look at your data. It's your stakeholders that are actually vaccinating the children, any community partners, and even here is a team, right? So it can be looked at in different ways. For purposes of this, we'll focus on the team within your system that has control over carrying out evidence-based interventions. So once you have your team, knowing it'll ebb and flow, people will tap in and tap out as appropriate. You'll probably have a few core people that move it along. Step 2 is making a plan. So once you have your people, you figure out, okay, what does our data look like? So we try to be very data driven. So we look at our data and we say, okay, this is where we are, this is where we want to be, which is our goal. I know y'all have a 5 percentage point increase. And you say, how are we going to do that? So the action plan is just a term we use for how. The action plan is where you put your timelines, your activity, your milestones to get to your goal. And this will always include evidence-based interventions and different quality improvement tools, which I will touch on in the next couple of slides. So once you have your team, you try to make your plan, you engage and prepare all your staff. So not everyone will be part of making that plan. The hope is that you'd get stakeholders involved and that everyone would feel good about the plan. But in order to carry out something like client reminders or EHR updates, you want to make sure that your staff know what's happening, that they feel confident about the HPV vaccine, about what a strong bundled recommendation looks like, or what the new alert will look like on their EHR before doing a large system change. So here's a really sweet spot for those PDSA cycles where you're saying, okay, we want to do this, but we want to try it so that we can fail small and then have big success once we tweak what needs to be tweaked. Step 4 is pretty straightforward. Get your patients vaccinated. So here's where we're rolling out a lot of our evidence-based interventions and tweaking as we go. So it's a cyclical process. A lot of these steps overlap with one another. And don't be afraid to revisit your plan. It's okay to tweak your EBIs, to refocus what QI tools you're doing. You'll see a lime green box on the left. That's basically saying that you ebb and flow through these steps. A lot of step 1 through 3 are about planning, and then you execute your plan in step 3s and 4. So this has been our generic framework, and it's always integrated into the quality improvement framework, which is, next slide, please. Here's just a visual of quality improvement overview, what has infused into the steps. So you choose your area of focus. For us, what do you want to work on? We're working on HPV vaccination. And then we drill down, is it initiation? Is it completion? Where, which systems within, which clinics within our system? Then our aim statement. You've already done this. So what do you want to achieve? And then the how comes into play. So figuring out how effective is the workflow currently and how can it be better? So 3 and 4 are process mapping. So figuring out, this can be varying levels of intensity. It could be a list, a bullet list, or it can be like Post-its and a Visio thing. But really it's asking, what does our process look like? Where are there duplications? Where can we be more efficient and have folks work at the top of their licensure? For example, having a standard order protocol in place. Then of course there's more QI processes, like number 5, you see gap analysis. This is when you look at gaps and see how to fix them. And lastly, the PDSA. So those are the ones that we're doing for our case presentation, where you figure out what the gaps are and how you want to tweak things, and then you start testing them. Next slide, please. Okay, so what we just did is I showed you a document that shows the 4 main steps: assembling a team, making a plan, engaging everybody, and then getting her done. We walked through the QI framework too, that it should be data-driven, and you should always revisit your aim and your data. And we know that there are evidence-based interventions that can increase HPV vaccination rates. There you see a link to the IHI QI Essentials Toolkit. That's if you want templates on how to do process mapping, what are some gap analysis templates that we couldn't dig into today, but are all available for you online. Next slide, please. Okay, so once we know our data, we make our goal. These are evidence-based interventions best when done in combination that we would integrate into our plan of how to get there. So I'm going to read off the left side bullets first in teal, and then I'll tell you about what the little splash icons are on the right. So here are a few evidence-based interventions that we, based on the data, encourage our systems to take on. Depending on which one they want to do. So not all of them, just whatever's the right fit. So professional education, of course, the highlight here being the strong bundled recommendation, and leveraging those clinical champions to change the attitudes and behaviors of not only your system, but of the patient. Provider assessment and feedback, of course, looking at data by provider over time. Standing orders, provider reminders, reducing barriers. We touched on some of these during the case presentation last month, which is exciting, but modifying hours of service, nurse-only visits, which is part of the case presentation for today, scheduling second dose at the first visit. So you're like, okay, before you leave me, when are you going to come back? And starting at 9 years of age. These have been really strong approaches. Client reminders and recall. I know this is a big focus for this project. This is notably helpful during series completion. And lastly, patient education. You'll see 2 splashes on the right side, basically trying to show you how the QI processes we talked about on the last slide and these EBIs overlap. In the green, you'll see you can map a process to uncover opportunities and which EBIs that you could use, mapping this process through the tool of process mapping. And in the blue, you'll see before rolling out an EBI, make sure to test small changes of how it's rolled out. And that's through a PDSA cycle. Next slide, please. So now I'm going to do kind of a rapid highlight of strong EBIs. So this is the king or queen. So strong provider recommendation is necessary for any intervention to work. It's the most significant factor if a parent decides to get their kid vaccinated. In the teal, you'll see an example of a strong presumptive recommendation. Now that your child is 11, they are due for 3 vaccines that are really important for all children. Their age, they will protect them against meningitis, HPV cancers, and pertussis. We'll be giving this at the end of the visit today. So putting energy towards this. On the next slide, you'll see various ways to do this. So I dropped these all here. You can explore the links later. But depending on your need, we have YouTube videos from both survivors and physicians that you could embed. or play in your waiting rooms. In the bottom left, you'll see a pre-recorded 1-hour webinar from Boston University by our Dr. Rebecca Perkins, a strong OBGYN physician champion. In the bottom middle, you'll see sample videos from the Minnesota Health Department where they show how to and how to not recommend the vaccine. So depending if you want to make it kind of funny or if you want to just get to the meat, role playing. In the bottom right, you'll see an interactive app. So this is more individual learning where you can simulate recommending and what you would say once a prompt is given back to you. So those are just there for you to play around with depending on what kind of education you want to do. Next slide. Okay, standing orders. There's a lot of stuff on here for you to revisit later, but essentially you're just giving a single physician order for all patients for all recommended vaccines. This allows the healthcare professionals in your system, so your MAs, your nurses, depending on the law in your state and with your system, but it allows them to identify eligible patients, track immunization history, educate their patients, and then if needed, bring in the provider if they have more questions, but ultimately administer vaccines. And on the right side, you'll see in big, bold red, it can help reduce missed opportunities. It makes it more standardized throughout the system. It takes work, but it's been very, very effective. Next slide. Here are 3 examples of standing order resources for you. The top one is a template. The second one is a what you should know kind of background information. And the third one are 10 tangible steps to get from your template to standing orders in place. So use these resources, don't start fresh. Next slide. Provider prompts, we all know these. These are mostly in our EHR. We don't really have stickies anymore, but if you do, they serve similar purpose. It can be a nurse prompt, an EHR prompt, even something from your registry. These are very effective for you as a provider, even through the triage process, through checking out to make sure that you're asked at every visit if they're due for the vaccine, if they will get it that day. Next slide, please. Client reminder recall, this is the biggie for you guys. So this will also overlap beautifully with today's case presentation. It mostly involves some type of notification that someone's due for something and ideally has some type of educational component. It can be done a million different ways. The best way to do it is the one that works for your system and how many resources you have, and the one that your population is most receptive to. So it can be telephone, automated, or real person, letter, postcard, text message, patient portal, registry. Lots of ways to do it, but we know that it's very effective for bringing folks back in. Next slide. All right, I just have 2 more. So here, as far as reducing missed opportunities, here are some key bullets that we've talked about a little bit last month, but I wanted to reiterate. Administering all vaccines each patient is due for at every opportunity. So this will be a protocol question. It came up last month when we talked about potential night and weekend protocols not always matching the day. But if there's a well child, a sick visit, sports physical, nurse-only visit, let's make sure to try to standardize it as much as we can, and if so, in the EHR. Make sure that you schedule the second dose before they leave, if that's a capability for you and your scheduling system, and consider starting at age 9. It's less you have to take at 11 and 12 and could potentially avoid some conversations too. Next slide. So in conclusion, make sure everyone in your system's on the same page. You'll all have different level of intensity around how you carry out the work, but them being part of the story is really important. Make sure that they know what their role is as part of it. So whether they're a front desk, MA, in the labs, what is their role around it? And make sure you're encouraging them to ask questions to see if they have any reservations or questions themselves so that you can arm them with the information they need to get on board. And of course, systematically recommending and arranging for the next dose. The HPV Vaccination Roundtable has great action guides specifically geared towards certain populations within your system. So MAs or nurses, front desk. I know that was in your newsletter. So make sure to use those resources that are available to you. That's my last slide. I went rapid fire, but thank you for your time.